Mabuhat magandang araw po sa inyong lahat. Ako po si Dr. Robert Buenaventura, guro ng Psychiatry at Human Life Cycle sa Manila Theological College, College of Medicine. For this video, I'm going to share a technology-aided online teaching learning strategy from the reconfigured instructional design that I've submitted. Although the document I submitted focused on a patient who presents with severe memory deficits, I have done similar approaches with patients who presented with depression, post-traumatic stress disorder, and schizophrenia. So for the purposes of this video, I'm just going to give a general overview about the processes that I'm going to employ. First, in terms of asynchronous activities, I have relied mainly on our access to the Lecturio learning management system, wherein short videos on various topics can be assigned and accessed. Allow me to share some snapshots of these resources. In particular, they have a reasonably good selection of videos on behavioral and mental health. Here's the list of videos they have on psychopharmacology. For me, they are well made, short, and easy to understand. Second, in terms of synchronous activities, we have regular weekly online lectures and group reports done via Zoom. The students have also utilized an app called Kaboom, Kahoot, or something to ensure interest and attention by their classmates. Third, asynchronous simulated patient interviews were done by groups of 5 to 6 students. They were all video recorded and shared with the class for review and comment. The actor was provided various scripts to guide in the history of illness and mental status examination. This is the student guide to the simulated patient interview activity, including the objectives and grading system. This is an example of the script used by the patient actor, including the history of the present illness and the contents of the mental status. Fourth, these were followed by synchronous presentations and discussions in which the interviewing group presented their findings and non-presenting groups provided positive and negative feedback. A summation of the discussions were provided near the end by the undersigned. Fifth, formative assessments via short quizzes in Google Forms were done at the end of each session. Sixth, this is an example of a rubric used for presentations and discussions, including the criteria, description of each criterion, and distribution of points. Finally, the topics would be included in a scheduled formative assessment later on. In this example, some of the questions pertaining to the first case can be seen. And that is it for me. Maraming salamat po sa inyong pakikinig.